Yes? Okay, sure, let her in, please. Hello, hi, I'm Dr. Aula, a pulmonologist, likewise. How are you?
Good, thank you.
So, may I know why are you here? What are your symptoms?
For the past 1 month, I've been feeling like I'm gaining weight. I have wheezing, I have shortness of breath, coughing with Alwan, and good appetite.
So, how old are you?
I'm 14 years old.
Alright. So, based on what you have told me, I believe you have a disease called cystic fibrosis, and it is a genetic disease that affects the lungs and the digestive system. That explains why you have been gaining weight. We have to make sure that this is your diagnosis. We have to do multiple things. We have to do a blood sample to make sure the blood level. We have to do a sweating test because you said that you have a very salty tasting skin when you're sweaty. And then so basically the sweat test, it measures the amount of salt in your sweat using a chemical substance on the skin. And we have to do X-ray, CT scan, and MRI. I know that sounds a lot, but we need to make sure that this is your diagnosis. But before that, please excuse me, I want to check your heart and your breathing rate, please. Okay? Have a seat, it's okay. Okay, breathe in. Breathe out. One more time. Okay, from the back, one more time. Alright, I can really hear the wheezing and the whistling sounds in your breast, on your lungs. For how long have you been suffering through this?
For about 2 weeks.
2 weeks. Oh, okay, so it was all of a sudden. You haven't noticed that in the previous years.
No.
Okay, that sounds a bit odd because it is a genetic disease, but for now, before doing the test, I need to talk to the other doctor. I need to switch you there. She will check your digestive system and we'll just make sure before we take you to the diagnosis. You may proceed and talk to the nurse, please.
Thank you so much.
You're welcome. Bye. Yes, dear. Please page Reem to Dr. Malak. I need her ASAP. We need to speak about her diagnosis. All right, thank you.
Hi, Dr. Aula.
Hi, Dr. Malak. It's been a while.
Miss you.
Wait,
So good to see you.
Likewise.
So I heard that you want me. What's the
Yes,
issue?
I have this patient. Her name is Reem. She's a 14-year-old.
Okay.
And she's been feeling wheezing, shortness of breath, and she has a very good appetite. And she has been gaining weight.
Okay, so that sounds familiar. I guess it's cystic fibrosis.
That's what I have said, and I informed her. I told her that I put her in the system itself. But now I asked her to do a blood sample and a sweat test,
Okay.
an X-ray, a CT scan, and an MRI. I'm waiting for the results to come in.
Okay. So I think that she's also been feeling some issues in her digestive system.
Yes, so I want you to test that.
Okay, so since she has, we think she has cystic fibrosis, so I'm pretty sure that she's feeling some pain in her digestive system, in her stomach, and pretty sure that the mucus it's causing, it's blocking the small intestine from digesting the food.
Exactly.
So we have to run some tests, do a CT scan.
I've already told her to do that,
Okay.
as well as the blood test.
Okay, that's
So I think stool test is the only thing that's
Yes,
left.
we have to do that as well. So let's do that, and then we can just do a meeting and talk to her.
All right, dear. So I'll just add the stool
Yeah?
test. Yeah,
That's
that's perfect. All right.
Okay.
Okay, you can see the CT scan, the
Yes.
MRI, everything.
We
the
can
blood
call it
test.
a wrap.
Definitely.
Yes.
I think she has cystic fibrosis. Anyway, let
Absolutely.
me call her or call the nurse and let her in.
Okay.
Yes, dear. Please let her in. Thank you.
Hi,
again.
how are you? I'm Malak, Alwan, gastroenterologist.
Nice to meet you.
Nice to meet you too.
I told you that I'm gonna introduce you to the gastro gastroenterologist.
We discussed and we talked about everything you've been feeling, your symptoms, and we came to a conclusion. You do have cystic fibrosis.
Yes, based on the CT scan, the blood test, unfortunately, and as I told you, it is a genetic disease. I don't know, maybe one of your parents or your great parents have it, but it might also be a mutation. So
Absolutely.
there's this gene called CFTR gene defect, and then it is defective in the iron transport. Therefore, the airway surface liquid depletion, leading to a defective clearance, and then the mucus obstruction, the inflammation, and the infection, and so on.
Here we're talking lung-wise.
Yes.
All the symptoms.
I want to show you the difference. So basically, this is the lungs. You know, with the cystic fibrosis, this gene is causing this mucus in the airflow, which is then going into the digestive system. This is how your airway should look like. So yeah, you can see. So this is the mucus in the airways, and then it goes down to the pancreas, then into this small intestine eventually. I'll leave you with the gastroenterologist.
Okay.
Action.
Okay, dear. So, as you can see, due to the disease we just talked about, it's causing the mucus which blocks the air sacs, the alveoli in the lungs, and the mucus it blocks the pancreatic ducts and the stomach, which is causing all the symptoms you're feeling.
Okay, so we know it's a genetic disease, and finding a solution for it or like a treatment is somehow difficult, but I will prescribe antibiotics. Okay, this will prevent the chest infection, and I'll also give you some like OTC medicines that makes the mucus in the lungs thinner. Therefore you'll be able to breathe better. And I suggest you exercise. I know there's some wheezing, not to lose weight. Losing weight is something else. Because of the pancreas secretion, you are not able to lose weight or have a stable weight. But when you exercise the lungs, you'll be able to breathe better, and therefore you'll be able to have a better sleep, and so on and so forth.
And hopefully by like taking the antibiotics, doing all the things the doctor just talked about, exercising and etc. Hopefully you're gonna feel better.
Make sure you do a checkup like every
Once in a while.
Yeah, for that, so that we can like
Make sure that you're okay.
And
Thank you for coming.
Thank you for coming. Get well soon. I'll send the prescription to the pharmacist, and then you'll get the medicine. Thank you.
Thank you. Have a nice day.
Bye.
Bye.
I think it was a wrap. Huh?
Yeah.